Hi guys, Tim Baker here with livingwithcvs.com, and I'm getting ready to go to court. The reason I'm going to court is this is the second time I am appealing TANF, which is cash assistance. I'm applying for cash assistance while my disability is still being processed. I've had to apply for both of them twice. Now, the reason I'm applying for cash assistance is just to have a little extra income to support me until the disability kicks in. And the reason I'm applying for both of these is because I have something called cyclic vomiting syndrome. Let's see. Do you know someone who has unexplained, severe, stereotypic episodes of vomiting? So I was denied disability and cash assistance the first time I applied earlier in 2017 because the doctors reviewing my case said that they don't, the letter stated something along the lines of like, you can work. There's nothing wrong with you. You can work. There's nothing wrong with you. Well, I got a little packet here to explain a little bit about what cyclic vomiting syndrome is. Cyclic vomiting syndrome, what is it? CVS, cyclic vomiting syndrome, is an unexplained disorder of children and adults that was first described by Dr. Samuel G. in 1882. The condition is characterized by recurrent, prolonged attacks of severe nausea, vomiting, and prostration with no apparent cause. In some, there is severe abdominal pain. Vomiting occurs at frequent intervals for hours or days. 1 to 4 is the most common. The episodes tend to be similar to each other in symptoms and duration, and are self-limited with return of normal health between episodes. So these doctors think that people with cyclic vomiting syndrome can work when you have frequent, unexplained, prolonged, recurrent attacks of severe nausea, vomiting, and prostration with no apparent cause. How can you work at a job when you're vomiting? You can't. You're going to be throwing up. I've lost my job because of this. That's why I'm applying for disability, because I would still go to work and I'd still be throwing up. Like, you know, there have been times where I couldn't make it to the bathroom and I'd throw up on the floor. It's terrible. So, I don't understand how any doctor can say that anybody with this disease, with this illness, can hold down a job. There is no way, there's absolutely no way in hell that I can go and get a job and maintain a job with the reoccurring episodes that I have. Every single day is a different day for me. I have no idea how I'm going to feel on a day-to-day basis. I don't know if I'm going to wake up and be throwing up for 6 hours or dry heaving or break out in hives and be extremely fatigued because I just splued up my guts, or, you know, I have extreme abdominal pain because I have no food on my stomach, but I'm still dry heaving because, you know, for whatever fucking reason, I don't know. But I cannot believe that doctors actually know what this disease is and still deny people. Because how can you keep a job if you go to work for 1 week and you have no problems, and then the next week, 3 of those days, you don't go to work because you're throwing up? All right? And then the next week, you're fine. And the next week, you're fine again. And then maybe the week after that, 4 days you're throwing up. You just don't know. You have no idea what is going to happen to your body, when these symptoms are going to happen. You have no idea. They just hit you. They just, boom, hit you. It'll wake me up in the middle of the night sometimes, and I'll have to throw up in the middle of the night. And when you're done throwing up, you just feel extremely lethargic, extremely tired, fatigued, wore out, and I'm going to keep reading this packet for you guys. All right, so I already went over what CVS is. Occurrence. CVS begins at any age. It can persist for months, years, or decades. Episodes may recur several times a month or several times a year. Females are affected slightly more than males. The person may be prone to motion sickness. I don't really have motion sickness. And there is often a family history of migraines. And my family history, there is migraines. I don't suffer from migraines, but what they call CVS is an abdominal migraine. But I don't get migraines up here, but my mom does and my sister does. There's a high likelihood that children's episodes will be replaced by migraine headaches during late adolescence. Symptoms. Episodes may begin at any time, but often start during the early morning hours. That's typically how it is, but they may begin at any time. There is relentless nausea with repeated bouts of vomiting and retching. The person is pale, listless, and resists talking. And I can vouch for that because when I'm going through an episode, I don't want to be talked to. I don't want to communicate with anyone. I just want to stop talking to everyone because just talking makes me nauseated. And I get irritated and annoyed and irritable a lot easier now especially when I'm going through an episode. The person is pale, listless, and resists talking. They often drool or spit and have an extreme thirst. They may experience intense abdominal pain and less often headache, low-grade fever, and diarrhea. Now, I have Crohn's disease also, so sometimes I still have diarrhea, and if I have diarrhea while I'm having an episode, I have to sit on the toilet, shit my guts out, and throw my guts up at the exact same time, and I still got denied this shit. Alright, so prolonged vomiting may cause mild bleeding from irritation of the esophagus. I vomited so much, I had a white Mallory tear in my esophagus, and it was bleeding so much, it bled into my stomach, and I had to get a stomach pump put in to get all the blood pumped out of my stomach. I still got denied. I was vomiting so much that it actually went into my lungs, and I contracted pneumonia. And I still got denied. One mother aptly described her child's state during the episode as a conscious coma. The symptoms are frightening to the person and family and can be life-threatening if delayed treatment leads to dehydration. Now, I believe at one point during this year I was extremely dehydrated because I've passed out twice due to this. Diagnosis. CVS has been difficult to diagnose because it is infrequently recognized and is often misdiagnosed as stomach flu or food poisoning. There are as yet no blood tests, x-rays, or other specific procedures used to diagnose the disorder. The diagnosis is made by careful review of the patient's histories, physical examination, and lab studies to rule out other diseases that may cause vomiting similar to CVS. Triggers. Although some patients know nothing that triggers attacks, many identify specific circumstances that seem to bring on their episodes. Colds, flus, and other infections, intense excitement, birthdays, holidays, vacations, emotional stress, and menstrual periods are the most frequent reported triggers. Specific foods or anesthetics may also play a role. Treatment. Treatment is generally supportive with much importance placed on early intervention. A dark, quiet environment is critical for sleep. When I'm going through an episode, I just want to be in a dark, quiet room, period. Hospitalizations and IV fluid replacements may be necessary. I've been hospitalized more than once, and I still get denied. And they have all this they have all the documentation, and I still get denied this stuff. I've not worked since February of this year, and it's December. That's how long I'm really pinching pennies now. And I'm actually thinking about setting up a GoFundMe just to help string me along, just to help pay my bills, just until this stuff goes through, because it's just taking way too long. Treatment is generally supported with much importance placed on early intervention. A dark, quiet environment, hospitalization, and IV fluid replacement may be necessary. Medication trials often succeed in finding something to prevent, shorten, or abort episodes. I've not found anything. I've been on Protonics, Zofran, I don't even know, Nausine, Zofran, Protonics, Promethazine, Ondansetron, amitriptyline. I'm just trying to think of medications that the doctors have prescribed me trying to prevent these episodes or abort them. And if you're in the middle of an episode, you can't abort it. You're throwing up. I've not found anything. Now, there are things that can help reduce the frequency. I have found some things that help me reduce the frequency of my symptoms. Links have been made between CVS and mitochondrial disease, along with the use of CoQ10, L-carnitine, and other supplements. Now, the CoQ10 and L-carnitine, those are natural supplements, and I'll leave a link in my description for Amazon if you guys want to try it. If anyone has cyclic vomiting syndrome, I'll leave a link in the description so you guys can try the CoQ10 or L-carnitine. Just click that link and it'll take you straight to Amazon, and you can order it there. And other supplements. I also use hemp oil. I try to do the hemp oil drops. I feel like it helps my mood and calms me down a little bit, and I feel like it helps reduce the frequency of my symptoms, and I'll leave a link for that in the description below also. It is important to work with a physician who does his or her best to understand CVS and is supportive. Now, my gastroenterologist actually just referred me to a different specialist who specializes in cyclic vomiting syndrome. Now, the long-term treatment. The foundation of long-term management involves a responsive, collaborative doctor-patient-family relationship, sensitive to stresses caused by illness and to triggers such as feelings and attitudes that may predispose to attacks. Consistent, accessible physician care by a care coordinator who understands and communicates the nature of CVS, regardless of specialty, is vital to the family's well-being. Connections with the Cyclic Vomiting Syndrome Association, a family and professional network, does a great deal toward healing a family that has been in doubt and despair for years. So on the back of this, there are some medical references from the professionals, from patients. There are some primary advisors on here, but there's still not a lot of information on cyclic vomiting syndrome out there. So I created a website just to help get the word out a little more. It's livingwithcvs.com. I'll leave a link in the description for that below. And on my website, I make these videos, and I also write blog articles about how I'm feeling, what I'm doing that day, different methods that I'm doing or that I'm trying to help reduce the frequency of my symptoms. And I hope you guys find this video. I hope it helps. I hope you guys find some form of relief. If you guys find any relief that I didn't read, or if you know something that you've not seen that I've not shared on my site or on my YouTube channel, comment below. Let me know what you guys are doing, because I want to try it out too, because I still throw up, I still vomit, I still retch. I just try to be proactive in treating the symptoms, and it's just hard, and especially when you're applying for disability and you lost your job and you still get denied and you've been hospitalized and all this crap, and the government, you know how fast the government works, and I don't know, there's been, I think, 3 separate occasions where I've turned paperwork into the office and got a date stamp on it, and I got a letter in the mail saying that I never turned it in. And I have the paper with the date stamp actually on it, and then so when I try to call to say, hey, no, I turned this in, they're like, well, you have to file an appeal now. And I'm like, what do you mean I have to file an appeal? It's your guys' fault you guys didn't do it. I have the date stamp right here. Your letter that you sent me was dated, you know, let's just say December 2nd, and this date stamp was for December 5th, so it took me 3 days to turn it in, and now it's December 17th, and you guys saying you haven't received it, and I got the paper right here? I'm sorry, sir, you have to file an appeal and go through the process if you disagree with our decision. And it's like, well, you guys made a decision based off of faulty information because someone's not doing their job right. It's a mess. So, if you guys are applying for disability, be adamant about it. Make sure you're crossing your T's, you're dotting your I's, because it's a freaking headache. It is a bad word. It is a bad word. But I have court here in a little bit, so hopefully I will have some good news, and wish me luck. That's all I got today. And don't forget, subscribe to my channel. Hit that bell icon. That will notify you of every video that I release when I release them. Don't forget, I'm going to leave a link in the description for the L-carnitine. That's just an amino acid, and the CoQ10. You can get those at GNC supplement shops and whatnot, but I'm going to leave a link in the description to Amazon. It's probably going to be cheaper on Amazon, so just click that link, go straight to Amazon, get it there, because if you go to GNC, you're going to pay twice as much for it, I guarantee it. Yeah, let me know what you guys are doing. I want to know how you guys are feeling. Comment below and tell me what methods are helping you, or supplements that are helping you, or foods that are helping you. Just anything that helps alleviate and relieve you of your terrible symptoms and helps you live a somewhat normal life. All right, this is Tim Baker with livingwithcvs.com, and I am out.